Hello everybody, welcome to this session. In it you'll hear from real-world patients on their views living with a rare disease, their thoughts on gene therapy development and its impacts via NF2 Biosolutions. So I am, as Anna said, the lead and chair for the UK arm of NF2 Biosolutions. So, as I said, I'm the lead and chair. NF2 Biosolutions is a global entity, and we have a registered charity in the UK called NF2 Biosolutions UK. Thank you for joining me in this session. It's a patient's perspective of having NF2 and the need for a cure via gene therapy. So NF2 stands for Neurofibromatosis Type 2. It causes tumors to grow along the nerves, typically in the brain and spinal cord, but also elsewhere in the central nervous system. It leads to deafness, blindness, facial palsy, loss of mobility, and extreme pain. It's very rare. There are less than 2,000 people with NF2 in the UK. And the picture here, obviously that's me in the bigger picture, but the collective there is my team of volunteers. And it's important to say that we're a patient-led charity, and everybody involved has their lives affected by NF2, either themselves or somebody in their family. So, who are we? My involvement in the organisation is, as I said, because my family have NF2. And we'll be hearing from my daughter, Olivia, a little later on about her experience with the condition. NF2 Biosolutions, or NBS for short, was founded by scientists, medical doctors and patient advocates from all over the world that have been personally touched by NF2. Our board of directors, seen here in the larger picture, fight for their children, and they bring a wealth of professional knowledge to this not-for-profit organisation. We are 100% volunteer run, we're patient led, with ambassadors all over the world. We draw no salaries or expenses, all money raised goes straight towards our cure. Central in the main picture there is a lady, Dr. Nicole Henwood. Nicole is the founder of NF2 Biosolutions and mother to AJ, her son. Nicole studied at the Institute for Human Gene Therapy at Pennsylvania University, where she now works in that hospital. And on the smaller picture there, standing on the right-hand side is Gilles Atlin. He's our vice president, and hopefully you will have attended his session on Monday morning at this conference. He ran a session called Accelerating Early Stage Research into Clinical Trials. Hopefully you attended that session, and I hear it went very, very well. And Gilles' daughter, Karen, has NF2. So our mission and vision, well, it's to seek a cure for NF2 via gene therapy and also next generation biomedical technologies. Our vision is we see a world where NF2 patients can live full and productive lives, free from pain and without fear of losing their senses, mobility and life. We currently support 4 research labs from world-renowned institutions that are now pursuing 3 distinct gene therapy approaches, and also a unique bacteriotherapy approach for treatment for NF2. You can see the list there, 1, 2, 3, 4, these are the labs we're working with. The first is a cytotoxic therapy strategy, which is to insert a suicide gene that targets and kills schwannoma cells. Secondly, an NF2 gene replacement strategy to silence and insert the functioning NF2 gene. Thirdly, a gene addition approach to insert the functioning NF2 gene into mutant cells. And finally, our genetically modified bacteria approach to attack NF2 tumor cells through direct killing. So here's a slide on what we're doing, how we do it and what we're up to. On the bottom left there, you can see our consortium that was due this year, 2020. In 2019, we held the same event, bringing together academia and biotech institutions and attracted the attention of the labs that I've just mentioned. So that was a huge success and really launched us forward. We are a 100% not-for-profit, volunteer-run, patient-led organisation. We raise funds as well as our profile from all the events and ideas you see here. None of the team claim expenses for travel or salaries. We have fun and seasonal fundraisers. We attend conferences, sporting events, we host webinars, and we sell merchandise. All our ambassadors around the world work tirelessly to hold fundraisers to help keep raising money. And excitingly, more recently, we have also started a tumour bank for tissue collection and rolling out a strategy to get as many people with NF2 to participate as possible so that we can start to join the dots to find our cure. We're very proactive, as you can tell. I've got a short video now on why we need to cure NF2 via gene therapy, and this is from 4 of our younger patients.
What scares me most about having NF2, I have a very big chance of losing my hearing. It's really hard.
I get worried because I don't want to become deaf. I want to be able to listen to music because I like music a lot.
If I couldn't dance, it would be very devastating because it's really important to me.
What I hope for NF2 is to find a cure for the people so that they don't have to go through surgery like I have.
We see these vibrant young girls and we can predict that over time they will lose their senses one by one. We know we have no choice. We have to keep going.
This is 3 tumors that I have in my brain. It's pretty terrifying.
I have a tumor behind my eye, so I'm blind in my right eye.
My mom says that she wished that she could trade it so I could be healthy.
She was just a medical mystery for many, many years, until finally she was diagnosed with NF2. All our hopes, our dreams for Jessica suddenly just dissipated to fear and uncertainty. The doctors told us there was no treatment, there was no cure for NF2, and that we just had to sit and wait and hope for the best. And that's when we discovered NF2 Biosolutions.
One of the most valuable things that NF2 Biosolutions is doing is taking families, clinicians, and scientists out of their silos, bringing them together.
And it is in that merge that now NF2 Biosolutions is promoting, facilitating, and in some instances even providing the financial means for some of these new collaborative efforts to move forward.
We can give these patients a normal life and take that burden of not knowing when the next bad tumor is going to arise out of their lives.
All you want to do as a mother is protect your child. And when you feel that you cannot protect your child, it's the hardest feeling in the world. I think the more people that we can get in the fight with us together, the greater hope that we have for our children and actually ending NF2 for good. And I don't think any of us will stop fighting until that happens.
Pretty powerful stuff. As mentioned earlier, I'm involved with NF2 Biosolutions because my husband, daughter and son have the condition. Olivia is here now and would like to tell you personally about her life in NF2. So I'm going to jump out of the chair and let her jump in. Olivia?
Hi, my name is Olivia. I'm 19 and I live in Surrey, England. I'm really active. I horse ride. My job is an equestrian groom, so I ride and care for horses every day and I love it. I was born to be outside with animals. I'm part of a netball club and I play in the league. I jet ski, walk my dog, party and have a huge appetite for life. When I was 15, I had a clinic as I had inherited NF2 from my dad. The consultant was reluctant to give me a brain MRI scan as I presented so well. Looked healthy and had no symptoms. Something in me wanted to see what was happening in my brain, and I didn't want to wait any longer and ask for a scan to be booked in. Very reluctantly, the consultant agreed and I had the scan. This is what the scan revealed. This is a scan of my brain with a tumour the size of an orange in my right frontal lobe. It's called an ependymoma. If you're not familiar with scan pictures, the fluffy clouds are the tumour and the black space is a sac or fluid-filled cyst. I could not believe what I was seeing and how I was still moving around okay. Emergency brain surgery followed just over a week later. They had to shave some of my hair off, and following the operation, I was very high risk of a lifetime of seizures amongst a whole list of complications from the surgery. I had gone from that vibrant girl in the pictures you saw previously to this. The scan revealed 4 brain tumours, the ependymoma, an optic nerve meningioma, and 2 further vestibular schwannomas on my hearing nerves. Within 18 months, I'd had 3 brain surgeries and was blind in my right eye. On returning home after one very painful surgery, I noticed a liquid dripping out of my nose. It was a CSF leak, which is the fluid that surrounds my brain, and I had to go back in. That was a really low point. I had a further 7 days after surgery on a drain to manage the pressure of the fluid around my brain to allow for healing. I missed my GCSEs, the leaver parties, and so much more at a time when all my friends were moving on except for me. I suffer with PTSD and I have no idea what is around the corner for me with this condition, and I try to manage my mental health best I can from day to day. Gene therapy offers me hope that the clock can be stopped on this time bomb in my body and that I can keep the senses I have left and my mobility. The work that NF2 Biosolutions is doing has inspired me to speak about my experience with NF2 today and to raise awareness. My understanding is that the NF2 gene is a good candidate for gene therapy, and this gives me a great focus and outlook for my future. Thank you. Here are some more patients with NF2 I'd love you to meet. Thank you for listening.
I have NF2 and we desperately need a cure.
I need a cure.
I need a cure.
I need a cure for NF2.
And I need a cure.
I need a cure.
I need a cure.
I have NF2. I need a cure.
I need a cure.
I need a cure.
I need a cure.
Ho bisogno di una cura.
I have NF2 and I need a cure.
We need a cure. My name is Olivia.
I need a cure.
I need a cure. And I'm working for a cure.
And I need a cure for NF2. I need a cure.
That concludes my presentation, but now I'd like to hand over to Chriselle, who's waiting to speak as well. She has a fascinating story. She has NF2, and I won't ruin her story for her because it's absolutely fascinating. So Chriselle, over to you.
Thank you. Good afternoon, everyone. So my name is Chriselle, and I am 28 years old. Today, I'll be sharing my story of being part of a rare disease community, not only as a patient, but also as a research scientist studying my very own genetic disorder, neurofibromatosis type 2. So I was 15 years old when we first found out that I have NF2, and during that time I wasn't really exhibiting any of the typical symptoms of NF2, such as hearing loss or balance issues. But my parents got concerned about small bumps that they saw in my skin and scalp. So this initially led us to consult a dermatologist to find out if something's wrong. So what we thought were just benign cysts or found in a biopsy to actually be of neurological origin. So this led us to a visit to a neurosurgeon who recommended that I get my first cranial MRI. This revealed that I have the hallmark symptoms of NF2, which, as you can see here, are bilateral tumors affecting the hearing and balance nerves, as well as a number of other meningiomas or tumors within the lining of the brain. This is all consistent with the diagnosis of NF2. So at the time of my diagnosis, I was still in high school back in the Philippines. So I went to the Philippine Science High School, which is a research-oriented and specialized public high school system in the Philippines, where I first got exposed to the world of science and research. And being an incoming senior, I was also in the process of choosing my track for college. My NF2 diagnosis ultimately led me to choose to major in molecular biology at the University of the Philippines. And between yearly MRI scans and doctor's appointments, it made me realize that there really isn't a lot that is known yet about NF2 and how to treat it, aside from the dreaded watch and wait or surgery and radiotherapy when they see that your tumors are starting to grow and become problematic. So for instance, when I was first diagnosed with NF2, they also found nodules within my cheek and my masseter muscle and thyroid gland, which over the course of just a few years grew to a concerning size. So we decided to put me under surgery to remove these tumors. Which is really devastating at that time because it was, I had a real danger of having my face paralyzed. So aside from science, music is also one of my passions, and I like performing and singing and making music. And that's also one devastating aspect of having NF2 is having bilateral tumors in your hearing nerves, which slowly robbed me of my ability to hear and appreciate music and speech. So my hearing nerve tumors are slowly progressing, and we were looking for non-invasive ways to treat them. When I was 18, I was recommended to undergo gamma knife radiotherapy to treat my tumor in the right ear. So this resulted to my tumors stabilizing, but actually led to me being deaf on my right ear. So my hearing in my left also started to decline a few years later, and I had to resort to using hearing aids to help with my hearing loss. However, in spite of all that is going on with my health, or actually because of it, I still pushed through with pursuing my career in science. And it became my ultimate goal to help find a cure for this dreadful disorder that is affecting me in many ways. So in 2012, I graduated with my degree in molecular biology after studying epigenetic mechanisms that lead to tumor growth in NF2. I then decided to pursue my master's to continue expanding on the subject, and I was able to present my research in multiple international scientific conferences. And in 2017, I was able to present my research to the NF scientific community when I went to the US in Washington, DC, to present my work at the annual Neurofibromatosis conference. And it was here that I first got to know other scientists that are focused in finding a cure for this devastating disease. At the same time, back in the Philippines, there's this community that made me realize that I had to do this. I had to do science to find a cure for NF2 because many people are in need for an effective treatment or cure for NF2. And from that point on, it made sense to me to make use of my unique position as both an NF2 patient and a scientist to help bridge that gap in scientific knowledge of this disorder. And I joined various organizations with the ultimate goal of promoting awareness and research for more viable treatment options for NF2. However, I believe the real game changer in finding a cure for NF2 came in 2018 when I got to know Dr. Nicole Henwood, who founded NF2 Biosolutions after her son AJ got diagnosed with it. So like me, Nicole was desperate to find an effective treatment for NF2 and couldn't believe that there are viable treatment options aside from surgery and radiotherapy. So I initially volunteered as the Philippine ambassador for NF2 Biosolutions, and later on, because of my scientific background, I was also invited to be part of the scientific advisory board of this organization. So we believe that gene therapy is a revolutionary treatment for NF2 because of its demonstrated effectivity in other related neurological disorders. And NF2 is also an excellent candidate for developing gene therapy strategies because of its being a single gene disorder, and also that the NF2 gene is small enough to be easily packaged into a gene therapy vector. So as mentioned earlier, NF2 Biosolutions is currently supporting two strategies for gene therapy to treat NF2. And right now, I'm actually part of one of the labs being supported by NF2 Biosolutions. In 2019, just over a year after NF2 Biosolutions was founded, we signed a contract with the Meyer Lab in Columbus, Ohio, in the United States to partially fund an NF2 pilot preclinical gene therapy project. So the Meyer Lab actually focuses on neurological and neurodegenerative disorders with a strong track record of bringing new therapeutic approaches to the clinic for the benefit of patients. And this lab was also previously involved in preclinical studies and translation of gene therapy approaches recently approved by the U.S. Food and Drug Administration for the treatment of spinal muscular atrophy, which is another neurological disorder. So in late 2019, I moved to the US to work as the research assistant for this pilot preclinical gene therapy project for NF2, 100% dedicating my research efforts towards developing this novel treatment for NF2. And so far, along with the other labs being supported by NF2 Biosolutions, we are making good progress in developing this gene therapy strategy for NF2, and it really gives me hope that one day soon, a gene therapy approach for effective treatment of NF2 is within reach. And all of this, of course, is not possible without the strong support from the NF2 patients and families, who are the only reason why we have achieved so much in just a short span of time in this fight to cure NF2. Thank you.
Thank you very much, Chriselle, for doing that presentation. So that concludes us, Alice. I wonder if there are any questions that anybody wants to ask us.
Yeah, and I think, first of all, I just want to say thank you all for giving this sort of 25-minute talk. I think hopefully I speak for everyone, where I think, yeah, it's a very powerful message, and also great to hear about the exciting developments sort of within NF2 and sort of accelerating that research. As you mentioned before, Claire, that workshop that Jill ran on Monday was all around how, you know, effectively accelerating sort of early stage research into clinical trials, and it's great to sort of hear that, you know, that progress and see some of that in action. As we say, we do have time for 1 or 2 questions. As I say, you know, please do post in the stage chat, and if there's someone specific that you wanted to direct a question to, just let us know. But I think to kick off with, I just had a couple of questions myself, and the first one, I guess, is sort of more directed to yourself, Claire, but obviously others can sort of chime in where possible. Is, I know you sort of spoke around some of the consortiums that you'd organised sort of for gene therapy. I was just wondering if you could sort of tell us a bit more about that and sort of why you chose to go down that route, and then also for this year, you know, as you know, we're not here in London today, we're here on a digital world, you know. How did you find that in terms of sort of transitioning from sort of being able to be all in a room together to sort of running things online?
Well, looking back, when we had our first, we're very young, you know, we're only 2 years old, and we've been working really, really fast. The team that have been organising the consortiums really worked at breakneck speed to get that first one up and running in April 2019, and to get all the delegates from all over the world to come into one place. And really that was our introduction to them, to let them know that we were here, and to start getting the conversation going around how we could sort of push this forward. And as I said, that's where we got the interest from the labs from. So, you know, it was a huge success. And I think because, as Griselle touched on there, the NF2 gene is a great candidate for gene therapy. There's a lot of excitement around what we're doing, and you know, lots and lots of hope. But yeah, so on that platform, you know, I wasn't involved in organising that at all. So I'm sitting here, I feel like I'm taking all the credit, and I should have none, because I didn't go into any hard work there at all. So that belongs to the rest of the team. And yeah, and we're all moving forward in this digital age, aren't we? So we may have to have more consortiums online like this, but yeah, we'll find a way.
Yeah, great. And yeah, I think question around sort of what some of the things around working with those different labs. I guess, yeah, obviously it's, you know, like you say, obviously important to, you know, like pursue all the, you know, different options, and, you know, obviously run with what works. I guess, wonder if, yeah, again, you could sort of talk a little bit more about, you know, how managing that process of sort of working with lots of different labs at once, and, you know, what that sort of looks like in practice.
Yeah, but Griselle, maybe you can offer your insight into working in the labs and how that's working given the current environment. Griselle, can you offer an insight into how it is working in the labs at the moment?
In the lab. So right now, the role of NF2 Biosolutions in putting together the labs is to find the most, you know, cutting edge technology that we have now, obviously gene therapy. So what we did was to find labs that might be interested in pursuing research for NF2. So for example, the lab that I am in now, the Meyer lab, has an extensive background in developing gene therapy strategies for similar, you know, rare neurological disorders. And the consortium in Boston that NF2 Biosolutions put together was really a key event in putting together all of these collaborations, because that was the first time that the labs that have, you know, interest and experience and expertise in this area was put together in a room to be able to talk about what the current challenges or roadblocks in developing gene therapy for NF2 is. And yeah, so that's how this collaboration with my current lab and the other labs being supported by NF2 Biosolutions started. And during the process, like right now, while we are doing the project, we like have regular meetings to update them of how the project is going, and get suggestions from other experts in the field who has more knowledge in the NF2 side of the project, because we are more in the gene therapy development side. So what aspects of NF2 should we consider in designing a more effective vector for gene therapies for NF2? So it's really very collaborative environment, just to make sure that we are getting the best strategy that we want to cure this disorder.
Yeah,
thank you.
Great. And I think, just got time for one more question, and perhaps I'll direct this towards you, Olivia, as it's sort of one each then, hopefully. I guess is for your side of things, just thinking about, what do you wish that people understood about you and sort of living with your disease? I guess what do you wish that people understood about that if you sort of had the opportunity?
Oh God, I've been put on the spot. I don't know what to say. Understanding about the condition and just people understanding it and recognising it. I'll just say more.
Yeah,
I don't know. I've gone blank. She's gone blank.
But maybe just around, it's about raising awareness, isn't it? Because if you go into the GP at the moment, like all rare diseases, and you mentioned about NF2 or neurofibromatosis, sometimes it draws a blank. So, I think if I can speak for Olivia, it would be around awareness. Do you agree? Yeah, raising awareness of the condition so that when people with NF2, lots of them, do suffer with hard of hearing issues, and it's to get people to realise, especially in this digital age, that there are lots of people out there that might look absolutely fine on the outside, but there's lots going on the inside, and being really mindful of what people present with, and deafness is huge in this new digital world. As everybody, we're all adjusting to a new world, but people that are deaf are adjusting to something that's very, very difficult with face masks on as well. So I would say raising awareness is huge for all patients with NF2.
Yeah, great. And I think, we've sort of just gone to our time for the session. And I think, I just wanted to say again, thank you so much for your time, all of you, to Claire, Olivia and Chriselle on this. I think, some really interesting insights. And I know Claire is sort of on the platform. So if anyone did want to reach out sort of more individually to Claire with any other questions, I'm sure she'd be more than happy to do that.
Absolutely. Thank you very much for the platform.
Yeah, great. Thank you.